Today's video, I'm going to be sharing with you all the signs of ovulation that has ever been recorded. Yes, all the signs of ovulation that has ever been recorded. Hi guys, if you're seeing me for the first time, my name is Precious. I enjoy sharing content like this that helps family trying to conceive during pregnancy and also postpartum. Now we've extended it to parenting as well, because when you have these children, you also have to raise them as well. So what are the signs of ovulation that has ever been recorded? A comprehensive list of all the signs of ovulation that has been recorded. Basal body temperature. If you follow me on this channel, you would know that I have talked a lot about basal body temperature. I've talked about the rise in temperature during that time of the month tells you that ovulation has occurred. But if there is no rise in temperature, it means that ovulation did not occur. Or if there's a rise in temperature and the temperature is sustained, it means that you're pregnant. If the temperature is not sustained, it drops, it means that ovulation has occurred but pregnancy did not occur. So basal body temperature, which is temperature at rest, is one of the most important, most accurate way of knowing that you are pregnant, and it's something that you need to be checking and tracking in this new year. It's not something that you should just leave to the side. You need a thermometer, you need a pen and a book by the side of your bed to know that to record when you're ovulating. This basal body temperature was actually first recorded in the 20th century. This is to tell you how way back this was recorded. Now people will say, oh, this is long time ago. Who told you that this is up to date? Actually, there are more up-to-date studies that have shown that basal body temperature is linked to ovulation occurring, and I can tell you that it is one of the most accurate way to show that ovulation has actually occurred. Cervical mucus changes. This one is the one that everyone knows, or everyone should know. If you're trying to conceive and you don't know the different changes that occur during the time of the month on your cervical mucus, then you need to go and watch the video. I'm going to be linking that video on the description section, where I made the different changes that occur on the cervical mucus based on the time of the month. Cervical mucus is very paramount to knowing if ovulation occurs, ovulation has occurred, and ovulation is about to occur. Now bear in mind that a lot of people don't actually get a lot of cervical mucus, but I know that most people do have cervical mucus. So if you want to know the time of the month where you need to be doing the do to get pregnant, you need to monitor your cervical mucus. This one should be known by everybody, and I don't need to talk about it. Ovulation pain. Ovulation pain, this is a very mild pain on either the left hand side of your ovaries or the right hand side of your ovaries that actually tells you that ovulation is about to occur. Why do you have pain? The reason you have pain is that for the egg to be released, the egg will need to go through a membrane. Going through that membrane to come out is what gives you that tiny pain. Now the pain, depending on the side of the ovaries that you're having that pain, most likely that's the side where ovulation is going to happen in. So right hand side, ovulation is going to happen on that right hand side. Left hand side pain, most likely ovulation is going to be happening on that left hand side. So the pain during ovulation. Now most people don't know about this pain. Most people think, oh, I don't feel any pain. And I say to them, you just need to, the business of life has made you don't know that you're experiencing pain. You do experience pain. Most people experience pain. So pain during ovulation is a thing that needs to be bear in mind. Changes in the cervical position. Yes, this is one sign to say that you are actually ovulating. The cervix becomes softer during the time of the month, higher and more open during ovulation. You will ask yourself why. It's common sense. If it's softer, if it's open and it's higher, it makes the sperm to swim through easily. So this is one thing that people need to bear in mind, is that during that time of the month, the cervix becomes softer to allow the important messengers to go in. It becomes higher to allow again, and it also opens up a little bit again to allow the most important messengers to go in to do the job that they need to, that needs to be done. So the cervix, or the position of the cervix, changes during the time of the month. Most doctors know. You can actually do this yourself, check this yourself, but I would not recommend you to do it. But most medical practitioners know about it. Increase libido. This one, I guess all of you experience this. That time of the month where your body will not stay one place. That time of the month where you'll be running from one place to another, chasing your partner like a he-goat chasing a she-goat. That's a sign that ovulation is about to happen. Why is this happening? Because that's the time that you can get pregnant. The body is such a sophisticated machine that it knows what to do. Naturally, things happen at the right time. If nothing, there's no external factor changing thing or no issue going on in your body, things happen naturally. So within that time of the month where you start running from one place to another, chasing your husband, loving on him, even when you're supposed to be upset for one thing or the other that he has done to you, that just know that the babies or the ovaries or the eggs in your tummy are calling you babe, or calling you mercy, or calling you Edna. It's time for you to get pregnant. Check yourself. You will know when it's time for you to do the do, just naturally. Breast and nipple tenderness. This one, a lot of people experience it as well. During that time of the month, your breast, your nipple becomes so sore. Some people just become sore. Some people just become so sensitive to touch that the tiniest touch, they feel it so well because it's so sensitive. When you experience this sensitivity on your nipples, on your breast, or soreness on your nipples, on your breast, or heaviness on your nipples, on your breast, that's a sign of ovulation. These are all signs of ovulation that have ever or that have been comprehensively recorded or listed. Light spotting. People experience a little bit of spotting during ovulation. Most people don't experience, but there are other people who experience light spotting. Bear in mind that these signs of ovulation, you have a combination of 1, 2, 3 happening at the same time. Some people experience all of them at different times of the month. You just need to understand your body and know what happens to you and what doesn't happen to you. I haven't experienced spotting before as a result of ovulation, but people experience spotting. Why do you experience spotting? Remember I talked about the egg rupturing. For the egg to come out from the ovaries, it has to go through a membrane. That rupturing out of that membrane into the fallopian tube to swim and get fertilized and now gets implanted into the uterus. That is what causes a little bit of bleeding. So people experience bleeding during ovulation. Increased sense of smell. There are people when it's that time of the month when they're about to ovulate, they can smell things like the way rats can smell crayfish, or the way rats can smell something inside of the house, far away from them. Okay, so I guess this is based as a result of hormonal shift, or having an estrogen, progesterone, and all those kind of hormone in your body causes this increased sense of smell. Bloating. Personally, I experienced this. During the time of the month, a lot of people experience bloating. What is bloating? Bloating is when you feel a sense of heaviness around your abdomen. You can have a lot of gas in your stomach. You can have a lot of retention in your stomach or around your abdominal area. That is called bloating. Anything that causes heaviness around your abdominal area can cause bloating for you, or can be seen as bloating. Not necessarily bloating, but can be seen as bloating. So bloating is a sign of ovulation. Mood swing and energy boost. Now, you can have mood swing where you are happy this minute, you're sad the other minute, you can literally cry your eyes out the other minute. That's mood swing. Energy boost is where you want to clean the whole house. Where is that mountain that is before you all this while? Bring it. I am going to level it. Anything that has seemed to be, or you've seen to be a big thing for you, you struggle to do, you don't like doing it, during ovulation, bring it. You're going to do it. Okay, when you find yourself at that time of the month where you can clean the whole house, you can cook 3-4 dishes. You ask yourself, do you have superpower? People will be asking you, what's going on with you? Do you have superpower? That is a sign that ovulation is around the corner. Add that to your list as a sign of ovulation. It's not because you ate breakfast bar, or it's not because you had protein shake. It is because ovulation is around the corner. Number 11, this is the one that I really want you to actually pay attention to. This is called changes in your saliva. Do you know that during the time of the month that there are changes in your saliva? Has anyone told you that there is something called Ferning pattern that would happen? So when you put your saliva in a slide, now this is something you can see under the microscope, okay, not with your physical eyes. When you put your saliva on top of a slide and put it under a microscope, you will see a pattern in your saliva. Now, normal saliva will look like this. So saliva that ferns would have a different pattern, okay? Normal saliva will look like this. Saliva that ferns will look like this. Can you see the difference? Has anyone ever told you that during ovulation your saliva pattern changes? The way the structure is under the microscope changes. This is why you need to sit down on this channel and watch this video to the end, and keep watching and watching other videos. This is also the reason why at this point you need to press the subscribe button, you need to press that like button, you need to press all the things that needs to be pressed, because you've learned something new. Did you know about it? No, you didn't. Now you know that your saliva pattern changes during ovulation. The pattern depends on the woman's menstrual cycle. It depends on your menstrual cycle. Now know that everybody's menstrual cycle is different. Yours can be 28, mine can be 30, the other person can be 29. So this ferning pattern depends mostly on the woman's menstrual cycle. So when our ovulation is approaching, the ferning pattern will be denser and thicker. Abdominal fullness and tenderness. There are people who experience this and there are people who don't experience this. During the time of the month, you feel very full. Now, this is different to bloating, okay? I know I mentioned fullness in bloating. Bloating is more of gas. You can physically see your tummy. But this one is more of a feeling where you don't look bloated, but you feel fuller. You feel like you're heavy around your tummy area, okay? Around your abdominal area. So fullness or tenderness. Tenderness is feel a little bit sore around your stomach area. That could be a sign of ovulation. Luteinizing hormone surge. If you follow me on this channel again, you will know that on this channel we've talked about increase in LH surge. When your LH surge increases, that is ovulation just about to happen, because that's the hormone that actually triggers ovulation to happen. Estrogen triggers the onset of ovulation, the egg getting ready to come out. Luteinizing hormone is what actually says it's time for you to come out and it's time for you to be released. So you need to know the difference between these two hormones. Elevated estrogen. Now, we talked about luteinizing hormone the other time. Now we've talked about estrogen. Estrogen, when it's elevated in your blood, how can you know? You can do a blood work. You can also use strip. Now, some strips only dictates luteinizing hormone. That's why if you're getting a strip, you need to know which one is dictating. Estrogen can be detected in your wee as well, which is something you need to bear in mind. But you can also get a more precise level of estrogen in your blood when you do blood work. So either you do a blood work or you get a strip, you can use that to detect estrogen. Estrogen tells you that ovulation is about to happen, because it's one of the hormones that works with luteinizing hormone to help you understand that ovulation is about to occur. If you're on this channel again, you will know, but that's something you need to add to your list. A fuller and a more sensitive vulva is a sign of ovulation. You see subtle swelling, sensitivity in the vulva area, okay, due to increased blood flow. At that time of the month, you have an increased blood flow to your vulva, an increased blood flow to that area. Now, whenever there is an increased blood flow to an area, things begin to happen, okay? That's where healing takes place. That's where that part of the body becomes very sensitive. Now, the vulva becomes very, very sensitive when there's a little bit of blood flow. So when you observe that your vulva is a bit swollen due to increased blood flow, that is a sign of ovulation. Now, these are all the signs that have been recorded for ovulation. The ones that I've mentioned that you know before on the channel and the one we didn't know before, we've now added all of them to our toolkit to have a total of 15 signs. Is there any sign that I haven't mentioned that you think, precious, you skipped this sign? Let me know in the comment section what that sign is. But these are the 15 signs that have been recorded, comprehensive signs that ovulation is happening, ovulation is about to occur. As someone who is trying to conceive, you need to have these signs. You need to know all of this. Put them in your toolkit and know when you're experiencing this or the other. A combination of 1, 2, 3 can tell you that ovulation is happening. Combination of a lot of them can tell you ovulation is happening. If you don't experience any of these signs, you need to go see your doctor. There's something not right. There is no way that you're having ovulation that you will not experience in at least one of these signs. Have you enjoyed this video? If you did, please press the subscribe button to say that you enjoyed this video. Most importantly, press the like button and tell me on the comment section what parts or what points made a lot of sense to you. Thank you so much for watching this video. I will see you on my next video.